Germain. I'm 65 years old and I've had a lifetime of grappling experience. Started when I was 12, 13 years old, victim of bullying. You know, real tall for my age and very skinny, and got picked on a lot at school. So that got me onto the mat in judo. And then after probably 35 years of competitive judo, I started blending Brazilian Jiu-Jitsu into it. I tore one ACL in '83, right before I was getting ready for the '84 Olympic trials. I was trying to make an Olympic team back then. So that started about a 27-year rehabilitation period. I hurt my other knee, didn't tear the ACL, but it was badly sprained, and I learned that, you know, ligaments, once they're stretched or torn badly enough, they don't heal. So I used to go into judo tournaments with both knees taped up and braces and the whole bit. Until one day I was rushing to go to work. I was coaching judo at the time at Summerlin Academy in Bartow. And I did a step pivot to get into the van, and boom, what was left of my second ACL was gone. I had 2 torn ACLs in a sport like judo. I'm dead in the water. So I'm like, all right, after dodging the scalpel for 27 years on this knee and 25 years on my other knee, I finally was like, all right, I got to go have them looked at and have them fixed. And that's when I met Dr. Vo.
He had anterior cruciate ligament tears in both of his knees. We evaluated him, and eventually he decided, along with me, to have his knees reconstructed, both anterior cruciate ligaments, and he had some meniscal tears too.
And I remember kind of jokingly saying, can you do both of them at the same time?
That is very unusual that we do both at the same time. Usually one tears at a time. But because both of his knees were very unstable, and he was not able to carry on his profession and his daily activities even. So he decided to have them both done at the same time, and he was relatively young and healthy, and so the risks are low.
I had never had surgery before until my knees. I still remember Dr. Vo, you know, swinging by, make that patient contact. He was way reassuring, and he treated me as an athlete, you know, not an old guy.
It's one of the more common surgeries that we do in sports medicine, is to reconstruct the ligament. That means to create a new one. The ligament is very short. It's only about 1.5 inches long, and once it tears, it's very hard to reconnect. So we use a biologic graft, either from the patient's own tissue or from tissue that had been donated to the tissue bank. He had to do a lot of rehab, and he was very determined and did very well.
And I had surgery March 11th, 2011. I had just turned 52. And so I'm flipping through the calendar, and on December 11th, I said, okay, that's 9 months. And 6 days later was a jiu-jitsu tournament. I said, all right, circled that date, and I said, God willing, that's my comeback date.
And the good thing about him is after he's well, I hadn't heard from him for a few months, and then he started sending in to me these emails that he's competing again, and he's won many worldwide competitions. That was pretty awesome to see after the bilateral knee reconstruction. 26
tournaments, 20 BJJ, 38 first place, 75-0. That's just since my knee.
Since the surgery?
Just since my surgery. I don't have to worry about subluxation, spraining. I don't have to worry about braces. You definitely gave me a huge extension to my competitive life. If it needs surgery, especially on the knees, he's the guy.